Good morning. This is the Board of County Commissioners agenda setting work session. It is Tuesday, June 28th, 2022. It is 9:05 a.m. This is a hybrid meeting. We're in Building 1, Room 280. Thank you. For public virtual attendance, you may follow along on the Thurston County YouTube channel. I'm Carolina Mejia. I'm the chair of the board. Vice Chair Ty Menser is excused for this week. Commissioner Gary Edwards is joining me here in the boardroom, as well as County Manager Ramiro Chavez and Assistant County Manager Robin Campbell. Today, the first item on our agenda is a COVID-19 update.
Good morning, Commissioners. Kurt Harden, Interim Director for Public Health and Social Services.
Are you talking?
I am. Can you hear me?
No.
There's a little delay, so go ahead. If you can start from the beginning, that'll be good.
Okay. Good morning, Commissioners. Kurt Harden, the Interim Director for Public Health and Social Services. Today's update is the last weekly update for the board. We're switching to a monthly update, or whenever the Commissioners, whenever you request additional information, we're available to provide it. Today is day 874, and I should say that this first started on January 20th, 2020, when the first patient was diagnosed, not only in the country, but in the state of Washington. So as we go through, the update is as of June 26th, unless otherwise noted. The total cases in Thurston County are, as reported by the state, are 53,628 since the start of the pandemic. Unfortunately, the deaths within Thurston County, as reported by the state, are 426. Our 14-day per 100,000 case rate is 429.9, and that's slightly better than last week when it was 430.6. And still a far cry, though, from the 88.7 that was the middle of April when we were at our low. And again, the numbers are are hovering around the 430 mark for the 14-day transmission rate. Hospitalization data is as of June 26th as well. Since the start of the pandemic, we've had 2,470 people who have been hospitalized for COVID. The current patients, we have 26 COVID patients as of June 27th. And that's around the same number as we had last week. We had 29 last week. We have 26 this week. The number on ventilators this week are 2. Our ICU bed availability is 12 adults, and acute bed availability is 15 adults. Our congregate care outbreaks are as of June 27th. We've had 229 congregate care outbreaks since March of 2020, and we currently have 32 congregate care outbreaks that are ongoing. Our vaccination statistics have changed a little bit in how they're being reported, and I'll walk through those when I come to those changes. So as of June 25th, total vaccine doses administered in Thurston County are 548,762. The percent of people initiating vaccination is 73%. The percent of people fully vaccinated is 66.3%. Now, the percent of people initiating vaccine 16 and older, that data, and the percent of people fully vaccinated, that data was not available this week. And we went to pull it as of June 25th. So the last we have is last week's data, which was 82.8% for initiating vaccine, age 16 and older, and 75.3% fully vaccinated, age 16 and older. For the percent of population initiating vaccine, it used to be reported as 5 and older. Now we're reporting it as 6 months and older. So the percent of population initiating vaccine 6 months and older is 73.5%. The percent of population fully vaccinated has changed from 5 years and up to 6 months and up. So the 6 month and up is 66.7%. And then the percentage of eligible people receiving boosters has changed from 12 and older to 5 and older. So now that percentage of eligible people receiving boosters 5 and older is now 57.8%. A vaccination status, the Capitol Mall clinic location had its last vaccine clinic on June 26th. We are wrapping that up, moving out of the equipment out of there and everything. We'll turn that back over to the mall on June 30th. However, on June 28th, today, we will have at the Olympia Senior Center from 1 to 4 a Moderna vaccination clinic for age 12 and older. And then this coming Saturday, July 2nd, from 10 to 4 p.m. at the Public Health and Social Services Building located at 412 Lily Road Northeast in Olympia. We'll have a Pfizer and Moderna clinic for 6 months to 4 years old or 5 years old, depending on which vaccine they're getting. Pfizer is 6 months to 4 years old, and Moderna is 6 months to 5 years old. And for that clinic this Saturday, appointments are highly encouraged by going to our website. Testing, today we're testing in Rochester from 10 a.m. to 1 p.m. in the roof parking lot. Tomorrow we'll be at the Lacey location at 3811 Pacific Avenue from 10 to 1, and then that will close down our scheduled COVID testing sites that we've been ongoing over the past several months. We will continue to have strike teams available to utilize testing for congregate care outbreaks. And we'll also still have test kits available for people who need them, over-the-counter test kits by contacting Public Health and Social Services by calling us at 360-867-2610. And we've been giving out a large number of over-the-counter COVID test kits. With that, I'll turn it over to Dr. Abdelmalik for her portion of the update.
Good morning, commissioners. We are seeing a little bit of a plateau in reported COVID-19 cases, as shared by Interim Director Hardin. We are watching closely because...
Doctor, your connection seems to look a little bit off. You're breaking up.
Good morning, commissioners. Is this a little bit better?
Much better.
Much
Thank
better.
you, doctor.
Yeah.
So our case counts are showing a little bit of a plateau week on week. We're watching those trends closely. Last week we reported that at the time of our COVID-19 report, 29 hospitalized patients who had tested positive for COVID-19. And this week, that number is 26. We continue to watch these numbers closely. We've reached out to our hospital partners. The part of the reason why I'm mentioning this is that last week, the CDC changed the community level for COVID-19 transmission from medium to high. And this was due to our hospital admissions rate. So the metric that we crossed was having more than 10 hospitalized patients with COVID-19 per 100,000 population within the preceding 7 days. The fact that our hospitalization rate is not increasing is good news, and we do continue to watch that trend. With the community level being high, the recommendation is for folks to wear masks in indoor public spaces, regardless of vaccine status. Folks who are at risk for severe illness or are immunocompromised should reach out to their healthcare providers to determine if any additional risk metrics, so any additional mitigation measures are needed beyond, masking, distancing, being very cautious in crowded indoor settings. Folks who are visiting people who are at high risk for severe disease should consider wearing masks when visiting those folks, and should consider performing, an at-home test or getting tested for COVID before visiting. So we continue to watch, and we do. And I guess the other key piece to mention here is I did want to give a little bit of an update on on the circulating COVID-19 variants that have been detected in Washington State. So just a little bit of a reminder that the variants that are the variance report lags by about 2 weeks, just because of the length of time that it takes for a sample to be sequenced. So in terms of the circulating variants, the variant with the largest share is the BA 0.2.12.1 variant, which has 46.7 as of June 12th. The BA.2 variant, which has 30.7%, BA.5, which is 16.4, and BA.4, which is 6.2. So BA.4 and BA.5 are a lot of what you're hearing about on the news. And really what we're seeing with those new variants is that they are more transmissible than previous variants, but it's highly unlikely that the disease that they cause is more severe. So we continue to watch. So we do continue to watch the situation, but it is good news that we didn't see beyond last week, we didn't see a significant jump in hospitalizations, and we're in communication with our hospital partners. I did want to add an additional piece of good news, and that is that folks between the ages of 5 and 17 now have the option of a Moderna vaccine, in addition to the Pfizer, which has been previously approved. And with that, I know that was a lot of information, but I'm happy to answer any questions anyone may have. Thank you so much, commissioners.
Questions, Commissioner Edwards?
No questions, thank you.
I do have questions, and it's in regards to boosters. And, boosters became available for, the first booster, and then it became available for older citizens, a second booster. But now, I got a message saying children 5 to 11 years old, they can go get a booster now. So has that included them already? Like, how is that working out when it comes to boosters?
That is a great question. So there are boosters available for folks. So there are boosters available, I believe. So let me get back to you on the exact hard numbers, but there are boosters available, I believe, for the 5 and up, and then for people 12 and up who are immunocompromised. But I can get the exact ages. I know that there's been a lot of change in the last month, so I'll definitely reach out to all of you with the most updated information.
Thank you. And then in terms of child vaccinations, excited that those, we're going to be doing something for those interested. But I'm wondering, for the folks that feel more comfortable going directly to their pediatricians, is that going to be like the COVID vaccine where you could only get it at a direct provider, or how is that going to work with these 6 months and up vaccine?
So anyone who is a COVID-19 vaccine provider can dispense COVID-19 vaccine. In our community thus far, we've seen the most, many of our vaccine providers are facilities that serve children in the clinical setting.
Thank you. Well, folks, as you heard, there's going to be a vaccination clinic for those pediatric this weekend, correct?
Yes, ma'am.
It might put your July 4th weekend on a damper, but.
Hey, Kurt, can you state again where they can sign up to schedule an appointment for this Saturday's clinic?
Sure. They can go to our website and sign up for an appointment from our website. There's a button to click on, and it takes them to scheduling an appointment, and we strongly encourage that. While we will still honor walk-ins on a case-by-case basis if we have the availability, but we encourage people to go to our website.
Is your perception that we have a limit on the number of vaccinations that we can issue? Or perhaps that may not be the case.
Well, no, it's a capacity issue. And again, we only have so much capacity to take in people. Only so many vaccinators are going to be there. So we're just encouraging people to make appointments so they don't also get disappointed and have to wait in long lines.
No, and that's what I thought. I want to make sure that the clarification is more operational limitations than actual supply limitations.
Correct.
Yeah, thank you.
Great.
And I did want to take the opportunity, Commissioner Mejia, just to provide a firm information on the booster doses. So everyone 5 and up can get a single booster dose, and folks who are 12 and older who are moderately to severe immunocompromised can get a second booster dose.
Great, thank you.
Thank you so much.
Okay, next is, want to make sure that you don't have any questions are good. Okay, homeless strategies. And I see Keely.
Good morning, Commissioners. Keely Marino with Public Health and Social Services with a brief update today. On Friday and on Saturday of last week, both the north and south sides of Lily Road, where there were some encampments and structures there, were cleared, there were 3 individuals that were living there. 2, they were all offered and referred to shelter beds at Unity Commons. There was a couple there that, excuse my dog, who accepted the beds at Unity Commons, and one gentleman who was not present for the cleaning of those camps. We continue to meet with Department of Transportation, Washington State Patrol, Department of Commerce, and our city partners twice a week now as we make plans for what comes next. And that's all I have today for homeless strategies, and I'm open for some questions.
Thank you. Questions, Commissioner Edwards?
No questions, thank you.
And I don't have questions. Thank you, Keely. But Ramiro, I see your hand up. Go ahead.
Not necessarily a question, maybe a question to the board is, do you want to align the COVID-19 update and the homeless strategies update to once a month?
I would be okay with the COVID-19. I think I'd like to hear from Keely though as things go on, because it's quite a community issue yet.
Okay. Yeah, I hear updates all the time because I'm on the Regional Housing Council, but I think as things are fast moving, and I think it's great for all the board to be updated kind of on a weekly basis on what's going on, because things do change sometimes from one week to another.
Thank you.
So sorry, Keely, you're still on the hook. Okay, moving on to review the Board of County Commissioners draft agenda for our meeting of June 28th, 2022. So call the meeting to order at 2 p.m. At 2:05, we'll have one presentation today. So the Pledge of Allegiance will be led by Commissioner Edwards. That needs to change on the agenda.
Yes, thank you.
There will be approval of the Tuesday, June 28th, 2022 agenda and approval of the board meeting minutes from June 21st, 2022. At 2:05 or shortly thereafter, we will have one presentation from Public Works. It's the Sunrise Beach Road Northwest, January 2022 slide repair project completion. And Scott Limblom would be discussing that.
He will be given maybe a 5, maximum 10-minute presentation this afternoon related to the emergency response, the Public Works Department exercise on the Sunrise Beach Road Northwest. So you may recall during the significant rains that we had early in the year, portion of this road sloughed off, and which put us in the position to restrict the traffic to one lane. And it was a critical issue since it was affecting, that was the only access to close to 50 homes at some point. So you will hear from Scott, the county engineer, this afternoon as to some of the strategies the department exercised to address this emergency, which has proven to be successful. Scott?
That was a great summary, and I will make sure it is maximum 10 minutes, hopefully less.
Thank you. Commissioner Edwards, question.
No questions.
And I don't have questions, Scott. Okay, next there will be an opportunity for the public to address the board and county manager's update.
I don't have anything specific in terms of the public to provide testimony, but certainly we will receive some public testimony this afternoon. I do have a couple of updates for the board. One will be, and this is the email that I sent to you yesterday, and related to ordinance number 15308, which amended the Thurston County Code 6.68057, in which they authorized the county manager in consultation with the fire marshal and other officials to prohibit the discharge of concerned fireworks within the periods of extreme danger, fire danger. I have consulted with the fire marshal as well as the emergency services director, and they went through the assessment of the 10-day fuel model. The state reports, and as of June 27, shows that our area in the next 10 days will be well below the fire season percentiles. Also, the significant fire potential for June 27 shows minimal risk for large fires over the next 7 days. Additionally, the National Weather Service 7-day forecast put this region on a temperature just a little bit normal or below normal, and from June 28th through July 3rd, with a chance of precipitation on June 28, 29, also July 2nd and July 3rd. Based on that, I made the determination that there will not be a ban of the discharge of concerned fireworks in 2022. I will outline that this afternoon. I worked with the PIO. It was a news release issued. We have posted on social media, and we've corrected the dates as well. So that will be part of my report this afternoon. Any questions on that?
Questions, Commissioner Edwards?
No questions.
Yes, questions for Megan. How is that? I know it's generated public comment in the past, and I'm wondering kind of what you've heard as the news release went out.
There's not a bunch of comments. Sorry, Megan Porter, Public Information Supervisor. We haven't received a bunch of comments on it. We had comments that the dates were wrong. We fixed that last night, sent out a correction. But not many this year on it. There was more comments when we sent out the original county news story that we had put out that said, you know, there was a ban last year. There potentially could be this year. We got more comments on that one than the actual there's no ban this year, so.
Okay.
That to answer your question, Madam Chair, based on past experiences, we will certainly be receiving emails here in the Commissioner's office, either way. So
Either way. Okay.
That's just the nature of this action.
Okay, thank you.
Also, I will update on a couple of comments you've received from two citizens last week related to the status of the Grand Mount sub-area plan. And one of the topics was asked whether staff member has been assigned to this project. Yes, it has been assigned. And also will report what we have accomplished so far. And we have held 6 community meetings since 2018 to 2000. We have reached over 500 people in the area. Also, what we're planning to do is we're going to be presenting the status of this project to the Planning Commission in the next couple of months. And at this point, depending as to how the Planning Commission outlines the timeline, we're feeling optimistic that perhaps the Planning Commission will provide recommendations to the Board of Planning Commissions in the fourth quarter of this year. And we're hoping that early 2023, the staff will brief the board in terms of the recommendations of from the Planning Commission, where you may be in the position to take an action. I just want to report that based on the public testimony you received last week. Any questions?
No questions.
No questions. Okay, moving on to consent items. Item 3A, Public Health, a resolution or classifying position 40R01608 in the Thurston County Pay Plan and Classification Pay Plan.
Thank you, Madam Chair. You reviewed this item last week, and this is a request from the Public Health and Social Services Department to reclassify the Education and Outreach Specialist 3 to an Education and Outreach Specialist 2. The department has gone through the process to determine what will be the best suited position to address their business needs, In this particular case, they do not need an individual who has the supervisory responsibilities, which is the outreach specialist 3. So I believe the better suited position will be an education and outreach specialist 2. The result of this action, if the board decides to take on, it will be reducing the salary from $7,879 a month to $7,147 per month. It will be a reduction of $732 or 9.3% decrease. Any questions?
Questions, Commissioner Edwards?
No questions, thank you.
No questions. Next is the approval of the voucher list.
Thank you. For your consideration is for you to approve the week of June 6, 2022 voucher list for a total amount of $2,690,882.69. These items are in your consent agenda as we have exercised that practice. This is in a consent agenda because there is no items related to Interim.
Okay, questions, Commissioner Edwards?
No questions.
Okay, no questions for me. Moving on to department items from the Commissioner's office. Item 4A, set a public hearing for a ballot composition to increase the Board of County Commissioners to 5 members. And that's the resolution that you have attached,
Yes,
correct?
I have attached on your packet a copy of the draft resolution. And I know the board is well aware of the trend, but I'd like to take the time this morning for the members of the public to understand what is in this resolution. And so allow me to walk you through. I will not go through every single section of the resolution, but I will highlight the key pieces of it. And then I will walk you through how that aligns to the schedule that I have presented to you in the past couple of briefings. Under RCW 3632.055, the Board of County Commissioners of a non-charter county with a population of 300,000 or more or less than 400,000 may cause a ballot proposition to be submitted at a general election to the voters of the county, authorizing the Board of County Commissioners to increase to 5 members. It is expected that by June 30th, later in the week, the Washington State Office of Financial Management will release the county population numbers, confirming that Thurston County has reached over 300,000 population. That's when officially they will be updating the population. In the ballot proposition, which received a majority of the voter approval under RCW 36.32055, parenthesis 1 authorizes the size of the Board of County Commissioners to be increased again to 5 members. How that works out is as follows. The 2 newly created positions, that will be positions 4 and position 5, shall be filled at the elections to be held next year. In this case, will be 2023. The county shall be divided in 5 commissioners' districts if the boards approve this particular ballot measure, which will be achieving as nearly as possible 1/5 of the population of the county. To be clear, no 2 members of the existing Board of County Commissioners may be residing on a single district. Also, if the 5 commissioners are approved ballot measure, the Board of County Commissioners by no later than March 13, 2023 shall adopt a resolution creating the 5 districts. And this is done in a statute. And I'd like to go back to the schedule that I proposed to you. The schedule that I proposed to you is for you to consider approving the 5 district commissioners on your last meeting of December 13. And that is really in relation to the resolution, a joint resolution that we'll have with the Port of Olympia. It is 2 pieces of legislation that governs when the 5 districts should be approved and completed. For the Port of Olympia, the statute was changed in this past legislative session, which require any revisions of the 5 of the commissioners' districts. In this case, the Olympia Port of Olympia commissioners to be filed within the first week of the following year, in this case, first week of January in 2023. The Board of County Commissioners statute did not change, and that is why I have here as the last and the specific date of March 13, 2022. But I'm planning, as stated on the schedule that I submitted to you, to bring that proposal for you to take an action on December 13 to align with Port of Olympia. And this resolution outlines a couple of steps as to what if the voters don't approve this, and I will get you here in a minute. But I want to take the time in this to make a difference between the two pieces as to when each commission should be approving the revisions of the boundaries. Also, it states on the statute that if by March 13, 2023, the Board of County Commissioners has failed to create the districts, the prosecuting attorney of the county shall petition the Thurston County Superior Court to appoint a referee to designate the 5 commissioner districts. The referee shall designate such districts no later than June 1st of the year following the election, in this case 2022. The 2 commissioner districts with which no existing members of the board of County Commissioners permanently reside shall be designated as District 4 and District 5. Also, the statute authorizes again for the ballot measure to increase the number of county commissioners from 3 to 5, and this is the intent of this resolution for you to consider, send to the county auditor. Section 3 calls for, it speaks about calling of elections. The Board of County Commissioners request to the Thurston County Auditor, which is an ex-official supervisor of elections in Thurston County, Washington, to call and conduct a general election in the county in the matter provided by law to be held therein on the November 8, 2022 election for the purpose of submitting to the voters of the county for their approval or rejection of to increase from 3 to 5 commissioners. The ballot proposition, section 4, the clerk of the Board of County Commissioners is authorized and directed to certify, if this is approved by the board, by no later July 29, 2022, to the Thurston County Auditor, again as an ex-official of elections in Thurston County, Washington, and a copy of the resolution shall be submitted to the county auditor's office. And the deadline for submittal of any ballot measure for the November election is August 2nd, 2022. The proposition language is stated in this particular resolution. It states as follows: the Thurston Board of County Commissioners passed resolution will add a number to this resolution concerning a proposition to increase the number of Thurston County Board of Commissioners. This proposition will increase the number of commissioners of the Board of County Commissioners from 3 commissioners to 5 commissioners, who will be served in 5 separate newly created districts, should this proposition be approved and has a yes or no for the voters. Also, you have you will authorize in this resolution the county manager to be the person who will be receiving any matters related, any comments related to the ballot measure. I'd like to highlight section 7 of this proposed resolution and talks about the general authorization. The appropriate county official are authorized to perform such duties as are necessary to require by law to put the questions of whether or not to increase the number of board commissioners and shall be submitted to the voters. Should the voters approve this ballot proposition and similar ballot propositions put forth by the Port of Olympia, the Board of County Commissioners shall work collaboratively with the Port of Olympia Commission per joint resolution number 2021-11 to draw the new commissioner boundaries by forming a 3-member redistricting committee, which includes the chair of the Board of County Commissioners, the chair of the Port Commission, and the county auditor. And the staff is available to provide that technical support on that effort. each of the Board of County Commissions and the Board of County Commissions and the Port Commission shall take separate legislative actions to approve the newly created districts. And this is a point of clarification in here. If the Port of Olympia ballot propositions, this is going to be 2 ballot propositions as we discussed in the past, that's not passed, the redistricting committee may recommend the Port Commissions to abstain from approving the newly created districts. And that will apply also to the Board of County Commissioners. If during the general election, the voters does not approve the creation of 5 Board of County Commissioners districts, then that will stop all the effort. And also, Section 9, it states that should the voters in Thurston County approve this proposition, the county manager is directed to bring forward to the Board of County Commissioners an ordinance establishing the 5 new county commissioner districts in consultation with the prosecuting attorneys within 3 months after the November 8th election 2022. And this is just a timeline. And again, as stated in the past on the timeline that I presented to you, if everything aligns, I will be asking the board to take an action if they willing to on December 13 after you held a public hearing. Any questions?
Questions? Go ahead, Commissioner Edwards.
I guess in reverse order of how you went through that, on Section 7, will that body that's created be subject to the Open Public Meetings Act?
I don't believe so, sir.
Okay. I think that we should always try to comply with the intent of the Open Public Meetings Act and make sure that citizens are always advised of what we're doing. And where I'm going with this is I don't think we should ever have any backroom meetings about this particular topic. I think it's a big issue, probably bigger than we really understand. And however we put that Section 7 together, I think it should have the right number of individuals, that it should always be applicable to the Open Public Meetings Act. That's my suggestion. I don't know where my seatmates are on that issue, but.
May I address that?
Sure.
On the schedule that I provided to you a couple of weeks ago. From August 3rd through September 29, the districting team will develop recommendations. They will not be in the position to approve that. And I think you have a copy of this.
Yes, I do.
So by September 30th, a final draft of the new 5-member district shall be submitted to the county and the port. And I have it on the schedule here, on the weeks of October 10th through October 17th, joint work sessions to review the proposals between the Port Commission and the Board of County Commissioners will be displayed, and those are open to the public. So the redistricting team, you agreed in the joint resolution, will not be in the position to make any decisions at that time. They will just be providing recommendations to the 2 legislative bodies. So with the intent, there is enough time here, and I have it on November 4th, for both legislative bodies to come to an agreement, draft agreement of those. And again, any conversations between the Board of County Commissioners and the Port of Olympia Commission will be subject to the Open Public Meetings Act. Let me go back to the timeline between August 3rd and September 29th. It's a working session that will meet 3 objectives only. Is to achieve the population of 1/5 as stated in the state law, how the proposed boundaries will be. 1/5 of the population for each district, and also including the perhaps no precincts will be split as a result of that. And again, we will not be outsitting a sitting commissioner from any particular district. Those are the only three major objectives I believe the redistricting team will be achieving.
And I saw Elizabeth's camera come up. Elizabeth, did you have any input on this?
Well, I am listening, and I think Commissioner Edwards is bringing up a good point, and I think the county manager is also bringing up good points. I do think it's discretionary somewhat for the committee itself not to be subject to public meetings, but I think from a conservative point of view, I would agree with Commissioner Edwards that you may want to think about letting the committee meetings be open, because they're actually gathering the information to make the decisions, and how they gather information or what information they're using or relying on could be of interest to the public. But I guess what I'm saying, you can make a decision going either way. If you wanted to be conservative, Commissioner Edwards is making a conservative suggestion in terms of having the committee itself be subject to notice requirements of when they're meeting, and allowing the public to observe, not to participate, but to observe.
Yeah, what council has said is exactly what I'm proposing, to make sure that it's always open to the public, and not for necessarily to have input, but at least to observe exactly what is being discussed and the process as it moves forward. I feel it is so important to develop public trust the best we can. And by keeping it open to the public, announcing all meetings that are going to be held to the public under, if it isn't absolutely legal, that it's mandatory for the OPMA, I think we ought to do it anyway, and always have everything open to the public. And I don't know how to write that in to make sure that's part of a resolution that we vote on and authorize. So I guess that's what I'm asking council, if she could put something together like that follows along with everything here in section 7. I have no problem. I just think that everything we do should be as open and transparent as possible.
County manager, and then Elizabeth.
Maybe mandate in the resolution, considering that we have the Port Commission represented as part of this committee. I think we need to ask for their participation and opinion on this, if I may. My suggestion will be to add a language that the Board of County Commissioners encourages the redistricting committee to follow the Open Public Meetings Act. So that will allow to have a conversation with the chair of the Port Commission on this particular matter. So I don't think we can dictate a Port Commission to be part of that.
Okay, I guess I don't disagree with that. It's just I have had that exact conversation with the chair of the Port Commission. And I believe there's no problem that we've talked about the trust issue. And I think they'll go with it. I think we better have the ability for us as individual boards to vote on that particular issue before it finally goes out to the public. That's all I'm concerned about. And so I don't know what Elizabeth had to add.
I mean, I can draft whatever the board wants into whatever the board decides on this issue. A provision that would go into the resolution. And I understand county manager is recommending that we at least consult with the other parties involved to see where they are on it.
Well, then maybe drafting some language and sending it over to them. How I feel on the matter, since I guess I'm the representative on this, not by choice. You know, I don't mind either way. This whole process will be absolutely new to me. So, you know, I'm just going to be taking whatever recommendation the boards have and bringing it forth to the redistricting committee. And not a process I've been involved with. So if it's open, I don't, there's no objection on my part. Commissioner Edwards.
I guess I just want to say that that old statement that you might hear as part of a joke, trust me, I'm here from the government. I'm here to help. It gets a laugh every time. It gets a laugh because there's not a lot of trust with government. And I think that is what makes it so crucial that we maintain an openness on this process. And I'm just going to say, I don't think you want to have one commissioner saying, well, I think it ought to be open to the public and they ought to be able to view everything we do, and others not go along with this. So I'm just saying, I really think it is very, very, very important if we're going to even have a chance at success on this issue with the voters. So however, I would prefer that Elizabeth put something together, and yes, get input from the port. And if they object to it, well, I'm probably gonna opt for a severability clause of some type, because I will never probably accept behind closed doors discussions about this kind of a thing. So that's kind of where I'm at on it. Okay? And however council can figure that out to make it work, I guess that's the best way to go.
So Elizabeth will draft that, and then this is not going to be, we're just gonna be setting the hearing for this in the future, correct?
Yeah, but, I would like to have the draft resolution to be reviewed by the public as soon as you set the public hearing. So maybe work with Elizabeth before this afternoon, and we can bring back, as part of my presentation this afternoon, addressing that question.
I do have two other issues.
Go ahead.
Under the portion of section 4, Proposition 1, Thurston County Board of County Commissioners, I just don't think that reads quite right. And I think it ought to say
Which section?
Under section 4.
Okay.
The actual proposition language?
Yes,
Okay.
where it says, it says right now, the Thurston Board of County Commissioners. I really think we're normally referred to as the Thurston County Board of County Commissioners. Or just Thurston County Board of Commissioners.
Oh.
Is there a word limit?
Yeah, I think what she's proposed is just reversing the order of
Yeah,
the Thurston County Board of County Commissioners.
I don't even think it has to say, I don't think it has to have two counties.
Yeah, the Thurston County Board of Commissioners.
Yeah, Thurston County Board of Commissioners would
The
be
county
it.
has a number of boards of commissioners.
I don't know, what do you think about this, Elizabeth? Is that a technical wording of this that needs to be followed?
Yeah, I think you could say Thurston County Board of Commissioners.
Yeah, okay. And then, going back to section 1, maybe sub B there, where we went to 300,000 and less than 400. Is it right that if we were to hit the threshold of 400, it becomes mandatory that we then have 5 county commissioners, I believe?
That is correct.
Is that correct?
That's correct.
So I would at least like to have something in here, and I'm not saying that's the location for it. I'd like the public to know, hey, we're just getting ahead of things here. At 400, it becomes mandatory and they don't get any say in it. I don't know how to put that. I just think it's worth pointing out that because it became quite a issue of concern involving our Supreme Court when Spokane went through this.
Wasn't Spokane like forced to go to a charter though? Wasn't that?
No.
No, it was mandated.
It
And
was
then-
mandated.
And it was at that point, it was moved to 5 commissioners without the automatic. And Spokane County challenged that. This state Supreme Court said against it. So the statute stands, and you're right, it's mandatory for all the counties who reach 400,001. It automatic will be a 5 commissioner representation.
I just think it never hurts to give the public as much information as we can to verify, hey, what we're doing here is we're looking for, efficiency as in government. And
Well,
Do you want that in the actual proposition?
I'm not saying I do, it's a concern of mine that I think the public somehow, whether it's in our talking points maybe that we move forward with at some point, that's all I'm saying is, I wanted to make sure that I was right.
Will you feel comfortable if I outline that this afternoon when I present the item?
I'm fine, I'm fine with it. I just wanted to kind of have it as part of the record that if we're gonna if we wait, it's gonna be forced on us. This way we can have a lot of public debate on whether it's beneficial, whether it's not, and all that. Okay.
On section 6, it says that we need a majority of registered voters. Should that be voters that vote at the election? Rather than the majority, because the number of registered voters is much greater than the number who vote.
That's a clarification, yeah.
That's a great.
That is a clear point, yeah.
You make me feel bad that I missed it.
There are certain kinds of elections that have turnout requirements.
Yeah.
We don't want this to be one of them.
Right. Okay.
I don't.
Good point.
I'll double check the statute language on that.
Yeah.
Okay, well, I'll try to revise this based on the comments for this afternoon. And again, I'll walk through in detail this afternoon when I present the item.
Okay.
To make sure.
It'll probably be more important, I don't know about more important, but at least important that we get this ready for the public hearing itself, even though
Right.
I'm told we don't have to do it, in showing that we're trying to be as open and
Yeah,
transparent as
but
possible.
at least I would like to have a good draft
Yeah.
based on the comments, and just for the public to comment on that and the next in the next few days. So I will make sure that I will find a time before 2 o'clock to do some updates with Elizabeth.
That's great. Okay, any more on this?
Not for me.
Okay. Next, item 4B, set a public hearing to repeal and replace the commercial property assessed clean energy and facility fees.
Thank you, Madam Chair. You reviewed this. Hold on, let me put my papers away. As you may recall, back in August 24, 2021, the board has a revised resolution on, to implement the CPACER program aligned to the state legislature. Within that context, there was a little bit of unknown as to how the defaulting payments should be recovered. It was unclear in the law, and that particular resolution included the county treasurer be the author as to how they can be the one who recover the cost of those who have defaulted on their liens. The County Treasurers Association engaged the legislative session this year and provide a clarifying statute So we're in the process of revising the ordinance that you passed, which takes the responsibility of the lending institution to recover the defaulting lien payments and takes the county treasurer out of the whole conversation. So before the board can consider taking an action, you need to have a public hearing on this. And this particular item is for you to consider setting a public hearing for July 26, 2022 at 3:30 in the afternoon for you to receive public testimony before you can enact or consider enacting the revised resolution related to the CPACE. Jenica?
Thank you. I don't have any additional notes to that.
Thank you. Questions, Commissioner Edwards?
Yes, is there any requirement that the planning commission is involved on this particular issue?
No, sir. It's not a non-use.
Okay.
And I don't have any questions. Thank you. Next, emergency services, item 5A, basic life support agency contract amendment.
Yeah, thank you, Madam Chair. You also reviewed this item last week, the board. And this particular item is to move the EMS training classes from Medic 1 to the individual fire districts. This amendment contains modifications on the deliverables, which are in alignment with the transition of tasks between Medic 1 to the fire agencies. And in this particular item was recommended by the EMS Council on their meeting of June 15, 2022. This particular action requires to shift $9,998 from the current funding Medic 1 to the individual fire agencies for them to provide their training, EMS training. There is not really an impact to the budget, it's just shifting from one fund to another. And this is, I believe, is a more efficient way to address the training needs. Ben?
I think you nailed it. I don't have anything else to add to this point.
Questions, Commissioner Edwards?
I believe this was a unanimous recommendation from the EMS Council.
Yes, I can confirm it was a unanimous recommendation, and it exceeds 10% of the original contract value. That's why it's being brought in front of the commissioners.
Thank you.
I don't have any questions. Thank you, Ben.
Thank you.
Okay, next is Public Works, item 6A, contract award for Houston Drive Northwest Culvert replacement, CP number 63017.
Thank you, Madam Chair. On June 8, 2022, the Department of Public Works received 3 bids to construct the Houston Drive Northwest Culvert replacement. The bids were received, and the low bidder was. Elizabeth, can you mute yourself? Thank you. And the low bidder was proposed by Market Construction of Chehalis, Washington, with a bid of $423,692.25. The department is for you to consider awarding this contract with an additional 10% to cover any contingencies for a total of $466,061. This particular project will replace the existing 48-inch culvert with a 36-foot long, 12-feet wide concrete culvert. And this is location is part of the fish barrier program the board has authorized in the past. The cost of this particular replacement will be covered by the real estate excise tax fund. Marcus?
Good morning, Commissioners. Marcus Storvik, Senior Civil Engineer with Thurston County Public Works. The only thing I would add to the County Manager's summary is I know there was a question last week on the mileage. For Houston Drive specifically, this will add 1.25 mile of habitat to the program.
Okay. Questions?
No questions.
And I don't have any questions, thank you. And that will conclude our agenda for our meeting on June 28th, 2022. And so the agenda setting and the meeting set for July 5th, they are canceled due to the July 4th holiday as well as staffing issues. So we will have the agenda setting review for our meeting on July 12th, on Wednesday, July 6th at 1 p.m. So that is for the public if they would like to tune in. Next is Proclamations and Awards.
Good morning, Jamie Caldwell, Clerk of the Board. I don't have any updates for the proclamations and awards. For the boards and commissions, there have been no new applications received. The standing applications have been provided in your packet for review. I recently checked in with the staff contact for the LMTAAA, and she let me know that she's requested a formal written resignation from the member that was going to be stepping down. As soon as she's received that, I'll be reaching out to Ms. McGaffigan to verify she's still interested in filling that vacancy. Ms. May's term on the Housing Authority expired on June 27th. Ms. Simmons' term on the Storm and Surface Water Advisory Board expires on July 9th. She's requesting a reappointment at this time because she recently became the board chair and is hoping to avoid a term lapse. The remaining applications have term expirations coming up in July, and we received some supplemental information from Mr. Hanna regarding the Agricultural Advisory Committee. And on July 6th, when we review the July 12th agenda, that information will be provided to the board for review.
Questions, Commissioner Edwards?
So it sounds like we're not going to make any appointments until that July meeting. Are we doing anything?
On the art committee?
Mhm.
I believe you had a brief discussion last week. They would like to have a full board representation.
Okay.
And on July 6th, we'll bring that information that Mr. Hanna provided to the board for you to review. And on July 12th, when Commissioner Besser is back, then you will have to discuss the appointments.
Okay. Thank you.
Yeah, with the Ag Advisory Committee, since it was Commissioner Menster that requested that information from Mr. Hanna directly, I just want to be respectful of that. When does Ms. Faye's reappointment expire?
Which one? Which committee was she on?
Medical Service Council?
July, the end of July.
End of July?
Yes.
Okay. I don't know.
I apologize, Commissioner. I had that mixed up. Miss May there, her term expired at the end of June. It just expired yesterday.
So that's for the Housing Authority?
Yes, ma'am.
Okay, so Commissioner Edwards, do you want to reappoint that one today?
I'm good with reappointing today.
Okay, so, I didn't hear any discussion about this application from Commissioner Menser, so that's why I'm.
And how about, when did you say Dr. Faye's appointment is up at the end of July?
Yes, that's the one that I had the two mixed up that you were asking about there.
Okay.
The EMS council there, she is up at the end of July. I verified that with the staff contact 2 weeks ago.
Okay, and then, but then the Storm and Surface Water, one expires July 9th, and our
Yes.
next meeting is not until July 12th.
Yes.
Are you comfortable with moving forward with that one, or do you want to wait?
Okay. On which one again?
The Storm and Surface Water Advisory Board, Jacqueline Simmons.
I am good with reappointing that position.
Okay, so we're moving forward on the two ones that are about to expire, which is
Vog May and Jacqueline Simmons. Okay.
Housing Authority of Thurston County and the Storm and Surface Water Advisory Board. And then, and then the Ag Advisory Committee members will be discussing those once Commissioner Menser gets back, since Mr. Hanna has sent a response to him. And then for Sheila Faye, that's another one that maybe we can discuss when.
Has there been any other applicants or anything about that? I mean, I don't know why we couldn't go ahead and,
I haven't received any other applications and,
we could move that one ahead as well.
okay.
We'll go
today.
ahead and move forward with that one since part timer's about to be.
And, how about the Area Agency on Aging?
They haven't received the
Written resignation yet. He's,
Okay, so that's the holdup on
Yeah.
that.
yeah, she reached out, I touched base with her yesterday and she reached out for a second time to ask that sitting member to formally write in and resign.
Okay. So then we're moving forward on Emergency Medical Services Council, Sheila Fay. For reappointment, we're moving forward on Housing Authority of Thurston County, Bag May, for the reappointment. And we're moving forward on Storm and Surface Water Advisory Board, Jacqueline Simmons, for reappointment.
Yeah, those items will be for your consideration this afternoon.
Yes,
Thank you.
that will make our list a little bit less.
Okay.
Okay. PIO check-in.
Good morning again, Commissioners. Megan Porter, Public Information Supervisor. I don't have any updates for you this morning, but I'm available if you have any questions.
Questions, Commissioner Edwards?
No questions.
I don't have any questions. Thank you. Okay, briefing and public hearing decisions pending.
Nothing, Madam Chair.
Okay, we have 3 items and then commissioners' items.
Is there a break?
I'm considering, do you want to take a break now or do we want to tackle one of the commissioner items? How long is the medic one? Is it going to take around 15 to 20 minutes?
Yeah, probably.
What do you think, Commissioner Edwards? Break now or
I
break?
guess.
Break now?
I think, the way I'm looking around the room, looks like it's okay with me.
Okay, Ben, we'll take a break now. We will be back, since we're a little bit ahead of schedule, we'll do 15 minutes. So 10:28.
You are live.
Okay, and we are back from break. It is 10:31 a.m. And we left off with commissioner items. We'll start with our first item, which is Medic 1 no-Divert program.
Morning, commissioners. I'm going to share a presentation here with you. Give me a hot second. Are you able to effectively see that, commissioners?
Yeah, go ahead.
Okay, perfect. My name is Ben Miller-Todd. I'm the Interim Assistant Director of Emergency Services. I'm sorry I did not introduce myself earlier in the presentation. I'm going to walk through just a couple topics regarding no-Divert. I know that we've briefed the commissioners periodically over the course of the last few years. This has been an ongoing issue in terms of the availability or the medical infrastructure available throughout the Thurston County medical system. And it ultimately plays a role in where we can go with EMS traffic as we are transporting patients in and around the county and also throughout the region. And I wanted to talk through a no-Divert trial that we ended up just completing. And it was very successful. And so we wanted to present you with just a little bit of background regarding that. In terms of what divert is, and in terms of diversion in and of itself, when a hospital goes on diversionary status, it's basically saying it doesn't have the staff or facilities to accept any additional emergency patients at that point in time. There are a number of reasons that a hospital may go on divert that are incredibly reasonable to do so. I've listed off here in green those items just as examples for the reasons why a hospital might go on divert, whether it's due to a power outage, whether they don't have availability of imaging, whether that's an MRI or a CT, specialty services related to nephrology, neurology, any sort of stroke services that may not be available, they may be on divert for. And then safety. We ultimately heard about a couple incidents where St. Peter's had to go on divert due to a firearms related incident. And that's something that safety plays a role in terms of when hospitals are on and off divert. All of those are incredibly acceptable and supported throughout the system. One of those that gets a little controversial, and I'll play into that here in just a second, deals with lack of bed availability or overcrowding. We obviously want to get the patients in our system to the hospitals that are able to care for them most efficiently. However, there's a little bit of controversy and more or less efficiency that surrounds the diversion for overcrowding. And I'll go through that here in just a second. But basically, hospitals have used the ability to go on divert for brief periods of time or not accept additional EMS traffic for brief periods of time related to the strain on that facility and staff that's available. This really doesn't reduce the number of residents in Thurston County or regionally that are seeking emergency care. And so ultimately, the volume of patients that are calling 911 doesn't suddenly get reduced at the point that a hospital decides to go on divert for overcrowding. They have to go somewhere. And when you then divert that river, if you will, of patients to another facility and basically take an entire facility offline, that creates incredible issues as we go, as you can see, that when you're diverting all of the EMS traffic into a single facility in Thurston County or within the region, that creates a lot of backflow, if you will, in the system and creates what we call higher turnaround times and higher patient loads on a given facility. So what is this 90-day trial that I speak of? This 90-day no-Divert trial was a coordinated effort that was actually promoted by the hospitals. And all three regional hospitals, which are Capital Medical Center, Providence St. Peter's, and Providence Centralia. Providence Centralia, I'll remind you, does serve a large portion of our South County residents, especially when we're transporting those patients to the facility that they desire. A number of times it's Providence Centralia. Those three hospitals work together alongside of the Lewis County and Thurston County medical program directors for EMS and all of the Thurston County EMS partners, both public and private, to come up with a solution that would basically create what would be a quote unquote no-Divert trial, where hospitals would not go on divert due to overcrowding. Previously, and the reason why we needed to do this is that this round robin style, and so we had gone to a solution that if all three hospitals in the region went on divert, we would share that patient load in a round robin manner, so that we did not transport patients outside of the region. That had really outgrown its usefulness for a number of reasons. It was cumbersome for EMS to keep track of which hospitals were on and off divert. It was a drain on hospital resources due to the administrative overhead that it required to manage the round robin process. And patients were routinely informed that hospitals were on divert and that they ultimately were struggling to get them into the hospitals that they preferred. So March 2nd, 2022 through June 2nd of just recently of this year, we just concluded the 90-day trial, and this is now beyond a trial. And I want to be clear here that because of hospital participation and becoming 3 partners in the region, those partners have desired to continue this forward, both from the EMS perspective and the hospital perspective, because it does address the 3 bullet points that I just listed very effectively to stay open to all services as much as possible. I will jump in here. And so how does this relate to the residents in Thurston County? How does this improve patient transport in Thurston County? Hospitals will continue to take patients even during times of high volume and high census. Otherwise, and I will call out that hospitals should not be refusing patients unless there are concerns regarding hospital capabilities to treat a patient. And then translating this in more to the how this affects our residents, EMS providers are trialing a load leveling tool to help reduce hospital overcrowding from the field. The following expectations apply as we're trying to determine the hospital determination that's most appropriate for those patients. I will reiterate this over and over again, that a patient always has the right to determine their destination. And this was both in the round robin process and within the current no-Divert system. But the priority here is that the patient always has a right to determine their ultimate destination. The most appropriate facility will take priority over the closest facility at all times. So if there are stroke capabilities available at one facility that are not at another, obviously the service delivery based on the patient's complaints would take priority. And in the absence of those two, in the absence of specialty service needs or patient choice, the closest facility should be the destination of the patient, so that we're not driving patients not only all over the county, but there was a brief period where we were going up into Pierce County or down into Lewis County, where transport destinations ultimately remove patients from their communities. And when we remove patients from their communities, it makes it much harder for family members to travel to those patients and ultimately for that patient to seek follow-up care with those facilities that they were transported to. Translation, residents should understand that they should consider the wait times provided by EMS at the hospital emergency departments when making their decision. So as I noted in the first sentence, trialing load leveling tools. What we've empowered EMS is with turnaround times at the hospitals in order to educate patients as they're picking them up and helping educate them on ultimately the hospital destination or the endpoint, and informing them of what those wait times might be when there's alternate facilities that could equally meet their needs and treat them effectively. I will slide into the system monitoring and then open it up for questions. There's a couple different things that we've been able to do. So in the upper right-hand corner here, I would like to call out that regionally, our IT team that includes Scott Brownell and Jarrett Latimer have created a hospital turnaround dashboard. This is something that's been viewed by both the region, the West Region EMS Council, and we've been reached out to by the state because the innovation involved with this. This takes our TCOM dispatch data on where ambulances, aid units, and medic units are being transported, and it translates it into how long are they having to wait in order to get a bed at each of those facilities. This hospital turnaround dashboard has been presented to the West Region as well, and regional partners are interested in potentially being able to construct something similar and build out this feature in order to more appropriately educate those patients on the wait times involved with hospital transport. Secondarily, we're also messaging the staffing of our private units that are able to transport. In the upper left-hand corner here, we send out routine messages to each of our EMS partners as to the staffing of each of the private ambulances throughout the system. And lastly, we're tracking by destination the average turnaround time of those units throughout the system. And so that's something that we're looking at turnaround time analysis on a month-to-month basis and addressing this in a variety of different factors, both from the IT level and the operational level. And with that, I'll open it up to any questions you might have.
Do you stop sharing your screen, Greg?
Absolutely.
Okay, questions, Commissioner Edwards?
In here, you've got several should or should not. What's the deal on should or should not? Is it policy by the hospital? Are there laws in place that, I don't know, they can't be turned down, can be turned down? Getting people out of beds. I'm told they don't have bed space because they don't have the current participants that are in the bed has nowhere to go for other rehabilitation. So could you cover that about should not, mandatory, what's not mandatory?
I heard 2 to 3 different questions here. I'm going to run through those and address them independently. There is still the applicable laws regarding with federal regulations, which are EMTALA, which deals with if a patient shows up in front of an ED or on an ED emergency department's property, they are required to evaluate and treat that patient to the best of their ability. Up until the point that they need to transfer them to another facility that may be able to meet their needs more appropriately. So yes, federal laws absolutely still apply as to when EDs must and are required to take patient care. The reason that, and I'll double back to another question, the reason that I use a lot of shoulds is because we're just clearing a trial. And so with any pilot period, there's obviously education that needs to be involved with staff on all sides, whether that's from the EMS side, whether that's from the hospital side, whether that's from dispatching side, or whether that's from any of our partners. There's always pieces that as we change process and we change pivot from something we've been doing since 2019 until now, there is the expectation that they should be following this agreement. With that being said, there is not a formal agreement in place at this point in time. This is an informal understanding between all those that are represented. And so there is a should, not a shall, that is utilized in a lot of the presentation. However, I will say that all 3 hospitals and EMS partners have been doing a wonderful job at following this. And I can say that our facilities only went on divert 3 times for a very brief period of time over that 90-day, now 120-day period. That very brief time was over the span of a couple hours. One of those facilities did lose power, which is well within reason. We do not want to be transporting patients to a facility that does not have power and capabilities. With that, there was a brief miscommunication in terms of overcrowding and going on divert, which was remedied within 2 hours and another couple incidences. Over the past, I can say definitively 30 days, we have not been on divert and patient flow has been going very well. So the should is more of a human component as we're training this throughout the system.
Okay, and maybe one follow-up to this. What would you say is the single biggest item that is contributing to this clogged up bed space where they cannot release somebody because that somebody doesn't have a place to go? They can't go to Uncle Bill's house, or they don't have a house, or they have no support mechanism in the community. So what's the bigger driver here?
You asked me for one, and that's like asking your favorite movie, and you end up listing off 5. And so I would say that I'm gonna ignore that you said favorite, and I'm gonna give you about 5 different factors. Number 1, you've even been discussing the downstream effects of a growing population in Thurston County. So underlying everything, we have a rapidly growing patient population because we have a rapidly growing population within Thurston County. That has created a number of strains within the system, both from the EMS volume perspective and the infrastructure perspective. I would say that secondarily to that is that we have a fairly high hospital census as we've been fluctuating through a number of COVID admissions that may take an extended period of time and take up a number of hospital beds. That's been trending down overall, but we see a slight bump over the last few weeks has been reported by public health. That takes up a little bit of bed space. Additionally, we have had limited infrastructure growth to support the population growth from the medical side. I believe our first growth in ED beds in well over a decade is actually going to be occurring next year in a standalone ED that's being built by Multicare, who are the new owners of Capital Medical Center. So there's been population growth. There's been an aging population, so that's number 4 there, an aging population within Thurston County. There's been limited infrastructure growth within the hospitals and care facilities in terms of acute care. So there's been growth in the urgent care side, but there hasn't been the same amount of growth for ICUs, EDs, and other things that are more acute care. And so those are just now being built alongside of a population that ultimately is being afflicted by COVID. And so you have beds that are being taken up for longer periods of time. So I gave you my 4 favorite movies on that one. And so I just hope, and I think that Kurt has probably one more to add.
Yeah, and Ben's 5th favorite movie is going to be staffing. There are staffing considerations at all these facilities, but what's happening, and Commissioner Edwards, you alluded to it, is you can't free up a bed inside the hospital if there's no place for the patient to go. And a lot of the long-term care facilities do not have the capacity due to either staffing shortages because of COVID to be able to accept that patient back after they've been sent to the hospital. And so there's a lot of factors that are contributing to this. I do know that public health and Department of Health on a regional and state basis are looking at these issues. How can we work to put some solutions in place? I know they're getting discussed. And right now, though, I don't think there's any magic or silver bullet that will help with the overall bed situation.
Oh, okay. That's I've heard your explanation, and I'm not saying it's not correct. It's just that the medical folks that I'm talking to, and those folks that from fire and such, are telling me something you're not mentioning, and that is the homeless population has become so needy, I guess, if you will. The percentage of neediness out of that population is causing that backed up bed space. So I don't know, maybe you guys don't want to say that out loud. I don't mind saying things out loud. I think we've been encouraging these folks to come here for the last 5 to 10 years, way more than we should have, because we're a very compassionate community. And that's what I'm hearing is the biggest driver. Nowhere for these folks to go when they are technically able to be released. Thus, they end up plugging up these beds.
So Commissioner Edwards, let me jump in on that and say that I don't have any data, and I don't know, maybe Ben does, but I don't have any data that either supports or refutes that information. We can go back and try to assess that, but right now we don't have anything that speaks to that one way or the other, unless I don't know if you have any information, Ben, that speaks to it.
Not specifically, but I will jump in here and just note that in terms of the overall percentage of calls, it varies greatly from agency to agency when you're dealing with throughout Thurston County. So when you're looking at where those that are, houseless throughout the system ultimately are located, there's a disproportionate distribution throughout the system, so that you're looking at Lacey, Olympia, and Tumwater that are responding to a higher call volume of those that are unhoused. With that being said, some of those result in transports and some of them don't result in transports. And so when I pull it back into this discussion, I would say less than, and after pulling the data, less than a third of the calls that we respond to those that are unhoused ultimately are transported. And so when we're talking about the diversion issue, and we start talking about the smaller numbers associated with that, the overall, the reason we list the top 5 that we did is that the overall infrastructure is looking at the 300,000 instead of the growing proportion of those that are unhoused. And so I know that that's a little bit of a statistical, twist there. But I don't have the specific number for you associated with those that are unhoused that are being transported.
Okay, I really do think that that's a number we don't want. That's why we don't have it. We don't ask for it. We don't want it.
Commissioner?
Because it points out that we've got a problem that we better deal with. And the other piece that I wonder about is, what about the fentanyl and all of that type of overdose activity? Now, I know some of those people don't make it in because they die, but those that do get some type of Narcom and then treatment or something, are we keeping track of that population as well? So there's certain numbers that we seem to not ask questions about. Now, if you come up with the right answers to those concerns, I'd like to know about them.
So Commissioner, what we'll do is go back. I'm going to put my public health hat on for a minute. Go back. We're going to ask the question if we can determine hospital beds awaiting discharge, patients awaiting discharge, to determine status and reason why they're awaiting discharge. And then we can see if we can break those numbers down a little bit more, because again, don't have the data on those who are awaiting discharge who might be houseless and then don't have a location to go there, but need to go back and we need to see if we can pull that information for you. It's not that we're not don't want to ask for that information. We can go get it. This was a diversion discussion, and we can go back and I can try to pull that information for you and bring it back for you.
Thank you.
Well, for me, I don't have really, a lot of my questions got answered. I'll admit that Ben has been kind of prepping me on this for a couple of months at our check-in. So I don't have any questions. Great job, County Manager.
Thank you. So Ben and Kurt, based on what you just stated, there is a commitment by the 3 hospitals to continue with this pilot program, no-Divert. But maybe following up to Commissioner Edwards' comment, shall, there's always the possibility, depending on the constraints they may face, individual hospitals, they can go back to the divert option. So, but I'd really like to express my, my appreciation for your leadership in having those 3 hospitals, at least looking at the issue in a cohesive way and embark on this trial program that has resulted on really is a common practice, at least at the commitment level for the 3 hospitals. So good news, thank you.
And I do want to reiterate that this is a commitment by all 3 hospitals' leadership as well, that they've been excellent partners in this.
Thank you, good work.
Thank you. Okay, next on our commissioner items, our Historic Commission emeritus status.
So thank you, Madam Chair. In the letter that you received from the chair of the Historic Commission, they stated that the regular scheduled meeting of March 9, 2022, the Historic Commission discussed honoring Ms. Sandra Crowell, who recently resigned from the Historic Commission, long-lasting member, I believe. And they have enacted to consider her Commissioner of Emeritus status. And this letter is a recommendation for you, the Board of County Commissioners, to consider the same in this particular status. Jeremy is here to provide additional perspective. This is a brand new item for me. I don't know what particular actions the board needs to take, so I'm just bringing this item for discussion, but I've not seen this in the past.
Jeremy, you want to give us some background also on kind of what the conversation was at the Historic Commission about this?
Absolutely, and good morning, Commissioners and County Manager Chavez. So the Historic Commission really wanted to honor Sandra Kroll for her great work on the Historic Commission's agenda and work over the last 10 years, particularly on spearheading the creation of the Waterwoods and Prairies History Book, which catalogs Thurston County's history, or much of the history, not all of it. And then also spearheading the creation of the Commission's Heritage Day event, which is becoming an annual event. They actually started this event in the middle of COVID, so we've done the past two virtually. And I realized that this isn't an official position in the code for the Historic Commission, but it is a request by them to honor her work and service to the residents of Thurston County.
So if the board members agree with this recommendation, what will be something the board needs to take? Is just a motion for them to consider and be done, or something more than that? If you can help us on that, because again,
well, I believe that previously we appointed someone to the Fair Board in an emeritus status, and I believe that was done at a regularly scheduled Board of County Commissioners meeting. I'll have to check back with Director Cummings on that, but we have done this once before for a Fair Board member.
okay, and I think you answered that question. Thank you.
Okay, go ahead, Commissioner Edwards.
I think this is just the tip of an iceberg that we should do a better job addressing. We've got over 40 boards and commissions that do a lot of volunteer work in Thurston County and help give guidance to the way this county operates. And I think we should do better in saying thank you to those people that donate their time and efforts to these individual boards and commissions. So what does that mean? I don't have a recommendation at hand that we should do X, Y, or Z, but I just think it doesn't cost much to say thank you, and we're not very good at it, to be honest with you, to try and recognize those folks. And I'm not being critical, it's just the reality. We're all so darn busy. A lot of things slip through the cracks, if you will. And I just think this is a good opportunity to recognize somebody that's obviously well thought of by their peers in this particular group. And we should always strive to do better and recognize and appreciate those that when we can, especially when it's brought to our attention by the different boards that have been mentioned here, both the Fair Board and the Historic Commission. So I would like to encourage this as a issue that, if nothing else, an appreciation certificate or something like that, but nothing wrong with this either, because then that party might feel like they're still welcome to add a little something they see is maybe missed. And I think they're all there to do the right thing, and I think that benefits all the citizens of Thurston County. So that's kind of where I'm coming from on this whole thing. So whatever it takes. I don't know the technical portion of that.
So that's what I was asking about, the technical aspects of, but I think Jeremy answered the question. So with your concurrence, we'll bring an AIS for you to consider taking an action on this request.
Okay, and I follow up with this. I'm kind of tight with the budget. I make no bones about it. I'm always kind of questioning. But when we get the amount of time and effort out of these citizens that are willing to contribute, you know, a certificate to put up on the wall, or I don't know, a little plaque or something showing that we do appreciate their service, because we're just not very good at recognizing that. So is that going to cost us some money? Yeah, it is. But just think of the money they save us in the overall operation of the county. You know, the budget's been way out of whack for the last couple of years because of COVID, but we're generally dealing with a budget that's over $300 million. I don't know how much it would cost us to have a few smaller plaques, or at least some type of recognition. I'm not saying that has to be it, but some type of recognition, frills around the appreciation certificate or something. Let's just do something to recognize their dedication to our community. Thank you.
If I might add, I believe that Director Cummings just sent me a short message. I believe Ann Shipley may have been designated as emeritus at agenda setting and may not have been at a formal board meeting. So it may just be a thumbs up this morning, and we can take care of that at our level.
That's fine. I'm good with all of the above.
Yeah, that's what I don't recall a formal action, but I appreciate the clarification. So, but if the board wants to have a formal action on the July 12th, in order to just really address what Commissioner was just stating, a little more of highlighting the efforts, that might be something that you may consider.
I mean, I know where our agendas sometimes they get filled up, but gosh, it wouldn't take too long to say, I'll say for the board chair to say, thank you.
No,
You know.
and no, I think you're right. And we got some feedback from someone on the Veterans Advisory Board a couple of months back, where he had, retired, or he left the advisory board capacity. He had resigned, and he was not disappointed, but just a little bit like underwhelmed, because he was like, I've served here for a long time. There was not even a thank you or anything. And so I completely see what you're saying. I know our records keeping in terms of advisory and commissions really haven't been on par. It's been kind of hard to track all of that information down. But as we're getting a new system in place, and I'm looking at Jamie over here because that's going to add, maybe this is something that we can start doing with them, having a certificate just like we do with employees, just saying, yeah, thank you so much for, once they decide to resign, just as an appreciation of thank you for your service and such advisory committee, I think would be appreciated by these volunteer community members.
Sounds good. So, Jeremy, the next meeting is July 12th. Go ahead and submit an AIS, and that will give the board the opportunity to highlight her service. And I will work with Jamie and maybe start developing a long-standing program of certification of appreciation for those volunteers.
Thank you. And I guess if we're going to do a formal AIS, it would be great to invite the Historic Commission and as well as Sandra Crowell to that meeting, just to recognize her.
It will be first on the agenda as a presentation, not necessarily as an action item.
Okay. All right, thank you.
And thank you, Jeremy.
Thank you, Jeremy. Okay, next is dangerous trees.
Thank you, Madam Chair. As you're tracking, the county holds in custody tax title properties. And these tax title properties we hold in custody for when the property owner has failed to provide taxes, then comes to the custody of Thurston County, and then we go through the process of surplus when the opportunity arises, and you have entrusted the county treasurer to go through that process, which he has been very effective on that. In between is when we have a dangerous trees, and sometimes we get comments, suggestions from the nearby property owners when they contact the county and determine that, from their perspective, there is a dangerous trees that may affect their individual properties. Large discussion, at least from my point of view, in the last 2, 3, 4 years. And I believe at some point the board agreed to bring any type of dangerous tree situations on a case-by-case basis. In order for us to determine whether a dangerous tree is in fact in danger to fall down, we need to secure the services of a professional. In this case, that's what you have here in front of you, the report of that. Because sometimes the perception of a dangerous trees from an individual property owner may not materialize in terms of being dangerous of falling down. So the item before you is we have, I believe, 3 trees in the same property, and I have attached the in your packet the property which is located off of, I believe is Covington Street, which is in the area of Carpenter Road and Britton Way, in that vicinity, nearby Lacey. So the proposal before you is we have gone through an estimate as to how much it will take to down those trees, and we have a total cost right now of $4,200.96. Robin, you like to add, or Jason?
Just to clarify, it is 4 trees.
4 trees, thank you.
That are in danger. If they fell, they would harm the neighboring property in the assessment of the arborist. And when it comes to tax title property, it's not only dangerous trees, it's whatever maintenance is brought to our attention on the tax title property. We do not actively maintain these properties because that would incur risk for the county, but when something is brought to our attention, we do need to address it, and we would pay for this out of the general fund.
Commissioner Edwards, questions?
Yes.
Go ahead.
I am concerned, and I take it this Covington highlighted property,
That's the tax title.
that's the tax title property that's coming up? That's where the problem is?
That's where we have the 4 trees.
Yeah.
Yeah.
And I want to make some kind of differentiation between what is a hazard. A hazard to a fence is one thing, because the fence might not amount to much. Hazard to a house or to safety, I think that's another issue. So somehow, if we do something on this, I think we have to differentiate between those 2 types of actions that we might take. Because otherwise, we could have property owners coming to us all the time and say, hey, this is gonna smash my fence and the cows are gonna get out, or whatever.
We do have property owners coming to us all the time.
Okay,
Yeah.
but I'm not too concerned about those. I'm a great one for getting things done, and I sometimes do things and ask for forgiveness later. You know, that's my motto in life. I know that's not the new way of doing business where the government's supposed to babysit you from, you know, the cradle to the grave. But I don't want to get involved in developing something that could then get out of control. I'm not against taking down trees. Even at that, I mean, if it's just a case of knocking the tree down, I don't know, I would guess we've got people on our public works staff that could go out and do that at a much cheaper rate.
No, Public Works would have to then bill the general fund for their work, and it does not cost less than this.
Well,
They're
I fall trees for neighbors in my neighborhood for miles around. I've been falling trees for many years. And I go out and take trees down for citizens all the time. It's not my business. I tell them that, but it costs about, 10 minutes of my saw running or something, and then they cut it up if that's the deal. So I don't want to get into a situation where we're starting to waste public dollars to do benefit for individuals that could have taken care of this themselves. I've got a prime example. I had the county tell me that I could not take a tree down. That was at 15739 Topaz Drive, no, 15735. Well, it's over on Pleasant Beach. Could not take the tree down because the eagles sat in the tree. And the wind changed direction one time, and that went right down through my house. And it went through the utility room and jerked all the plumbing and wiring, and the roof came, because it did it in a storm, the roof came off, and the insurance company then totaled the house. But not for replacement value, just totaled for assessed value or some darn thing. Anyway, I took a beating of about $100,000 on that deal because the county told me I couldn't take a tree down. Well, I should have not listened to him. I should have just went ahead and did it, saved myself the headache. Because I didn't bring legal action or even attempt it. I just think it can get out of control if we start trying to fix everything for everybody. So I'm against fixing everything for everybody, but I'm not against solving problems that might be hazardous to a house or to the kid's swing set or whatever it is. So that's where I'm at.
Is this money that we would get back if they were to be sold?
No.
Well, maybe if it went to, I don't know about no, let's not just say no, let's hope that there's a possibility on a tax title sale.
Why would we get the?
We could have a lien
money
against,
back?
lien against it.
Well, you know, if it goes for sale, I feel like this should be tacked on. I mean, it's just the cost of maintaining the property that.
Well, we could certainly talk to the treasurer about that. The minimum price that we can accept on any tax title property, should someone be interested in buying it. We've had no interest in this particular property. But the minimum we can accept is the amount in back taxes owed.
But not to say, and the board has many discussions related to tax title, surplus of tax title property. And you can set a price. Sure. You absolutely can set a price, when a property comes
We just
before
might
you.
not get it.
Yeah, you may not get it, but you can absolutely set a price. That is not out of your purview. It's within your purview to set a price. So.
Yes, we could work with the treasurer on that, but so far we've not gotten any interest in purchasing this property. And I would hesitate to tell property owners that they could go and just cut down trees on county-owned property. But it's the risk is, the amount of risk that the board would like to take is certainly up to the board.
I don't know, it sounded like Commissioner Edwards was volunteering. He says he's got the saw ready.
No.
It's hoping for quite a risk.
I call timeout on that one.
But probably a good call on your part.
So Jason, do we have any indication from the arborist on what type of risk these trees impose?
Yes, Jason Ash, Facilities Manager. Yes, we do. They are in danger of falling on two separate homes.
On the homes. Thank you.
Well,
That picture doesn't show anything like that. Looks like it's gonna fall in the brush. You know, I mean, they might, I'm not saying, I don't know the answer to that. Maybe there's some homes here that are outside of the view of the camera. That's possible, but I'm not too inclined to do this unless it's just like you said, Jason, it's just about to happen. There's no home there. Looks like there's a creek that goes across there. And if it falls in the creek, that's what trees do. They fall in the creek sometimes.
So Jason is saying that it has the dangers to fall into homes. Were you asking this for evidence, picture evidence?
Oh yeah, I want to make darn sure that the property owner isn't hoodwinking us a little bit here.
That is not the assessment of the property owner, that is the assessment of the
Well,
independent
okay,
arborist that
the
we
one,
have.
it's obvious it's gonna fall in the house. It's gonna fall in the creek. Where's the house? I don't see a house. And I can tell by the way that tree is leaning, it's gonna go across the creek.
Maybe you have right here, a map in the back.
Yes, I saw that.
Oh,
And back of
okay, right
this-
here's.
Back of this, Commissioner.
Yeah, I saw it. I did see a map somewhere.
On the back, on the
Right
back, on the back.
Right there, got it. Okay.
You see the house and you see the location of the streets.
So
Yep, I don't see that it's gonna reach the house.
well, maybe one,
No, not even the one.
because there are two.
There's two locations there.
It's two trees in each location.
Okay, well, I'm not convinced that that's good expenditure of tax dollars. Not at this point. I'd want more information before I decide.
I could get additional pictures if you would prefer, Commissioner.
Yeah, maybe a tape measure too. I'm not inclined to do it unless there's a real definite problem.
That is your prerogative.
Yep, absolutely. So you say,
I'd like more information is what I'm saying.
For me, if it poses a risk to the house, I'm always not averse to more information. For me, that would definitely, I don't want anyone to be at risk. But I do wanna, I know that there's no interest, but if there was ever an interest, I would wanna tack this onto that price, to try to get that money back.
We will absolutely convey that to the treasurer, that if there is any interest in this parcel. Yep.
If these are the two locations where the two green teardrops are there, and those are the two houses that might be affected, I don't know, maybe the teardrop's in the wrong place on that one, but it's a long ways from the house. And I can see where the creek goes there by the shadows.
Yeah, so maybe more information, because on the tree assessment, it doesn't show that there would be, that risk. So maybe getting that information and more pictures would be useful. So, not sure, yeah.
We'll get additional information and I will bring this item back on July 12th.
July 12th or next, July 6th?
Next week is canceled.
No, we're having on July 6th.
Just to review the agenda.
Okay.
I don't have any.
Okay, so next is other commissioner items. Commissioner Edwards?
No, I didn't come in to argue commissioner items until we have the full board.
Okay, I do have one, and these are in regards to emails that I got. And it's about a DCYF grant that the board approved by, and these were for grocery gift cards. And this was like an extension of a grant that we got. And I'm not sure what's going on. So I'm just kind of wanting to have some clarification on it since it already moved through the board. So I'm just wondering.
Could you share those emails so I can have a full picture of the issue?
The emails just basically say, that, people need the grocery gift cards, how useful they are. I did call Gretchen after we had our conversation. That was your recommendation. So I called her and I asked her kind of like, what is going on? She said that there was a concern with the contract and that they were looking into it. But that it did they had a deadline for June 30th. So considering that it's June 28th, I wanted to make sure.
Is the $35,000 grant from the state?
So I just wanted to be sure that I was responsive on my end.
Right. Okay, now I understand. There is an issue of the eligibility of the money.
From so it's a contract concern. So what is exactly going on?
So it is a eligibility concern. The state of Washington, in doing our due diligence, as we should do with any grant award that the county receives, we were ascertaining where the money was from, the source of the funding. It doesn't just come from DCYF. It comes from the state, and the legislature has to authorize it. So we were asking specifically, we were ensuring it was not ARPA funds flowing through the state because there are requirements attached to ARPA funding. We were told by DCYF that it was general fund, state of Washington general fund state, which was under a proviso And then when you look at the proviso in the budget, it specifically states that the department, meaning DCYF, is to contract with nonprofit, non-governmental entities to provide the services with the funding that's provided by the legislature. So the question is DCYF legally, because the proviso is part of state law, are they legally authorized to contract with a county, which is a governmental entity? The question that was asked was, where is the department's legal authority? And they said that there was precedence for working with counties. However, our attorney, we talked to our attorney about that, and the attorney said that precedence does not create an allowance to override a legislative proviso in the budget. He deferred to finance. I deferred to our county auditor. It was reviewed by the county grant manager, who said, no, we should not be accepting this money. We are not eligible. The internal auditor referred the question to the state auditor, who is talking about contract adherence, but has not addressed the fundamental question of whether it is legal for the county to accept funding that the state legislature has designated may not be contracted with a governmental entity. That is the issue.
So I understand that.
We understand the need. I apologize for interrupting, but there is no question that the community is in need. However, the money cannot legally come to us, we should not be accepting it.
But let me push back on this. We've already accepted money from DCYF. I'm guessing it's from the same funds, right? Because this was not them giving us new money. It was basically them granting us more money. So I'm just confused, because when I feel like if we're contracting, right, with a state agency and they're giving us the money for specific reasons, we're following the contract. We're following what they're telling us that we need to do. And so and I guess this question is more for Elizabeth on the liability for that. If we're following what the contract says, wouldn't DCYF be the ones who would be liable if the legislator came down and decided, we need to use, you weren't supposed to use these funds this way. We're just following the contract.
We would be liable.
For following a contract that DCYF gave us.
If the state auditor were to determine that DCYF inappropriately awarded the funds, the county, knowing this, would be liable to repay the funds.
But other counties have been using us, and we've already used these funds. I mean, we
don't know that we've used these provisoed funds. We do not know that.
DCYF distributes many funding sources.
That's right.
And this proviso came, and I believe you're right, and I think it's a little bit of timing here. And I believe that I need to express my apology to the board, because this conversation should have occurred before you consider taking an action accepting this grant. That didn't come to the surface until after the board authorized the contract for $35,000. You're right. DCYF distributes a lot of money to the county, but in this particular element, the $35,000 that you making a reference to, Madam Chair, has that proviso, and that didn't come to the surface until after the board took an action.
DCYF, could you explain
Department
that?
of Children, Family and Youth.
Services.
Children, Youth and
Okay,
Families.
I mean, public really need.
Yeah.
The public needs to know what we're
Yeah,
talking
right.
about.
It's a state agency.
So I have two comments. When this, because the board did take a formal action on this, when this issue came up, why wasn't this brought back to the board?
Because we've been working to resolve it.
Yeah, trying to resolve it. Because it came after the fact, and we're trying to resolve it, whether the item is we can find a way to receive the money, or we need to bring an action for the board to rescind that action. And that's where we are.
I tell you what, you're closer to this than I am. The little bit about what I've heard about it, I don't understand a state agency giving us money with this certain criteria of how it's supposed to be done. And then what, we're supposed to go get a legal opinion or second guess every entity that passes something on to us to make sure it's ironclad and we can do that? I don't know that that's our role.
That is our role, Commissioner, when it comes to funding, because the county is responsible for any money that we receive to follow all rules attached to that money, either state or federal. The color of the money doesn't change when it passes hands. The county is responsible to follow all rules attached to any funding that we receive. If we don't, we're at risk at an audit finding. And it is our responsibility to know where our money comes from and how it can and cannot be used.
What did the state auditor say?
We not gotten, the auditor answered the question about following the contract. The auditor did not answer the question about, is it legal for the county to accept this particular funding?
So the auditor just told us, the state auditor told us to basically follow the contract?
The state auditor said that if the county signs a contract, then we need to follow what the contract said. They have not told us if it's legal to accept these funds.
So 25 other counties are breaking the law and we're not? Or
Other
we already
counties
did?
have also questioned this. We've been told that other counties have raised this question as well.
But are other counties going ahead and using the money? I mean, because
do not know.
I don't want to turn away money from our citizens, right? And other counties are, using this money. We've had a great relationship with Department of Children, Youth and Services. We've had it for many years. I don't want us to have a rocky relationship and us not be considered for grants because that will be a detriment to our citizens. And that's my concern. If we're following the contract, and I just don't understand what our liability is because we are following basically what they're giving us the money for. We're not going around the contract. And if they're telling us this is kind of, what you're supposed to use the money for, then.
There is no question that our citizens are in need. There is no question that the county would like to use these funds for this purpose. The question is if we are a legal recipient of the money. And if we are not, then I cannot ethically advise that the county should accept the funding, even though there is great need.
So what other counties are questioning them? Because for me, and where I'm standing right now, I want to contact those other counties and I want to ask them directly if they're using the funds or not. Because again, if other counties are using it, they're following the contract from DCYF, I don't see why we are.
Could I bring up a topic on this? It's something similar, and it's just a question that I have. I've heard more times than I can put a number to that you can't do gifting of public funds And, okay, so is this kind of a gifting of public funds?
This is not at all
It's
a
not
gifting.
gifting.
That is
Okay.
not the question.
Well, when we say gifting of public funds, I asked the other day about electric chargers, and we're giving away electricity that some people come and charge the car up for free. And you said, well, that's okay because it's for the public good. Well, this is definitely for the public good. And I can't imagine why we couldn't help people as long as we're following guidelines given out by a state agency that certainly has legal advisors themselves.
So there is no question about gift of public funds. That is not the question here. The question is, when you read the proviso, if DCYF is indeed distributing money under the proviso that clearly states that the money must be contracted with a nonprofit, non-governmental entity, Thurston County does not qualify to accept those funds.
Even though we pass it through.
We're
We're the fiduciary responsible party, and that is the issue. And I'd like to probably echo Commissioner Edwards, we're trying to do the right thing here from the county's point of view. This issue was highlighted. The proviso is very clear. Whether the board wants to take that risk, that's a different story, and that's a different conversation, if I may. I believe we as administrators will have the responsibility to avoid the county taking unnecessary risks. And this is an unnecessary risk from my point of view. And I'm not here to argue the need, because the need is there. But I hope you appreciate what our responsibility is as administrators.
Well, I don't understand, you've asked the auditor for an example. They haven't got back to us on that. I don't know, do you do that through a text or something? Can't you just call somebody up and find out on the phone, hey,
I can
what's the deal?
certainly make some phone calls. I was following appropriate channels. We had Rick Peters participated in a meeting with Mary Hall. She designated the audit liaison, who is Darren Bennett, and our internal auditor, Brandon Weber, to be the contact people. And at that point, I stepped back and deferred to them.
Well, I guess here's a suggestion that I've got is don't step back. You've got a county board that's about ready to do something, and we want the right information, so I guess get the answers and get back to us. I think you gotta.
I can certainly make a call to I will let the auditor know that I am making a call, and then I will make a phone call to the lead auditor.
I'd like to know what the legal advisor from the state says too.
Right, yeah, because for following a contract that they're given to us,
Especially when the auditor said.
And
I understand the frustration, and I would invite Elizabeth to weigh in here. She is here.
You're mute.
I am here. Robin, you did correctly point out that Rick Peters is the attorney, been the point attorney on this issue. I have not been involved in any of the discussions. I've just been made aware of this issue. I would be hesitant to jump in and give any legal advice without making sure that I'm all up to speed on each of the different points. I understand the frustration and the question, and it's a challenging one. I think one of the perspectives has been, well, yes, we understand that the money needs to go directly to, I think the approach was the compromise, or the way to work with this legislation, as I understand the people that were working on this, was the county would be the pass-through, and this is different from typical pass-through contracts, is the county would not take any money for administrative purposes, but the money would go directly to the nonprofit. So the actual money is not being touched, or I should say, of any benefit to the county, but the benefit would purely go to the nonprofit agency, which is what's authorized under the legislation. So there's ways you can defend your actions, argue your action, and it's really a risk question for you. Robin's taking, and I'm not disagreeing with Robin or telling you to take one action over another, but there are clearly 2 points of view on this, and there's no black and white answer for you.
When could we have another discussion on this?
I will make a phone call as soon as this meeting ends. I don't know when we could come back to the topic before Thursday.
Is Thursday the deadline?
Thursday is June 30. We've been trying to resolve this for 2 weeks.
I'm inclined to just, if it's passed through, just pass it on to the
It
nonprofit.
is not intended for pass-through.
Well, okay, I guess there's answers to be obtained to give us some advice over the next couple of days to come up with a solution. That's all.
Yeah, well, probably the best thing, you can get our information. I will inform you individually of those conversations.
Which, I would like to know which counties were the ones who were having questions, so then I can also make calls.
I'll get the 2 specifically were mentioned, and I will get the list.
Okay, perfect.
Do I have time then for a quick?
Yes.
Just for the county manager. Have you heard anything about that Bald Hill Road on the curve up by Clear Lake?
No, I'm working with Public Works, and I need to get a little more detail on that. Yes. I'm working on that, sir.
Just a road problem in my district that the county manager's working on.
Okay, 11:38. Thank you all very much. Can't believe we finished before noon. We are adjourned.
Hey, Elizabeth, I'll call you here in a minute.